Hi everyone. Current lecture talk about the respiratory tract infection done by Dr. Suzan Yousif. Infection of the respiratory tract classified into upper and lower respiratory tract infection. These infection acquired mainly by inhalation of pathogenic organism which can cause infection in different parts of the respiratory tract as shown in this figure. The infective agents that cause respiratory tract infection include virus, bacteria, rickettsia, and fungi. And the infection can spread from the respiratory tract to other parts of the body, like in bacterial meningitis, which is often secondary to primary focus in the respiratory tract. For example, infection due to Streptococcal pneumonia, Haemophilus influenza, or Mycobacterium tuberculosis. The pathogens vary in their ability to survive in the environment. Some are able to survive for long periods, like Mycobacterium tuberculosis in dried sputum. Humans represent the reservoir of most of these infections, but some have a reservoir in lower animal, for example, in plaque in the rodent. The carrier play important role in the epidemiology of this infection. Now we talk about the transmission of the infection, which can be transmitted by three main mechanisms: the droplet nuclei, and the dust. The droplet can be defined as the particles that are ejected by coughing, talking, sneezing, laughing, and spitting. The infection which is transmitted by these routes can only take place over a very short distance because of their relatively large size. The droplet nuclei produced by evaporation of a droplet and characterized by small size which enable it to pass through the bronchiole into alveoli of lung. Also, dust represents one of the important mechanisms for infection transmission and can act as a reservoir for some of pathogenic organisms which derived from the sputum or stilled droplet. In addition to this mechanism, other microorganisms like streptococci, staphylococci, which can cause skin and wound infection, can cause respiratory tract infection also. There are many factors that play a role in preventing and restricting the infection for the respiratory tract. Some of them related to non-specific defense mechanisms like a mucous membrane, ciliated epithelium, reflexes like sneezing, coughing, a mucus secretion, lysozyme, and the presence of normal flora. Other factors related to specific immunity which may be acquired by previous infection or by artificial immunization. The control of airborne infection. The main principles involved in the control of respiratory tract infection are outlined under three headings: infective agents, mode of transmission, and host factor. Regarding the infective agent, the control depending on elimination of human and animal reservoir and disinfection of floor and elimination of dust, while in mode of transmission depending on air hygiene, avoid overcrowding, and personal hygiene. Also, the control can be carried out by specific immunization like gamma globulin for prevention of measles or and by chemoprophylaxis like isoniazid for prevention of tuberculosis. Now we take some example for respiratory tract infection like measles, which is an acute communicable disease characterized by fever, signs of inflammation with coughing and characteristic skin rash, and the presence of lesion known as Koplik spots on the buccal mucosa. The control of measles. The isolation of children with measles has a limited value in the control of the infection caused by this virus because the disease is highly infectious in the chorea phase before the characteristic rash appear. Active immunization play an important role in controlling the infection with measles, in which the children should be vaccinated at 8 months with one dose of live attenuated virus vaccine, while passive immunization help in prevention or modification of the infection by using gamma globulin. Other example for the respiratory tract infection is the mumps, which is an acute viral infection typically affected salivary gland. The incubation period varies from 2 to 4 weeks, and this infection caused by the virus which is known as mumps virus. This infection has a worldwide distribution, and the human represent the reservoir of the infection. The infection can be transmitted by droplet or by contact. One infection with the virus can produce lifelong immunity, while artificial immunization with live or inactivated vaccine can provide protection for limited period of a few years. Control of this infection can be carried by isolation of sick patients with strict hygienic measures, and also vaccination against this virus can give a protection for susceptible young person and give in combination with measles and rubella vaccine, which is known as MMR, that means measles, mumps, rubella vaccine. Now we talk about the important virus which is represented the major problem in the world nowadays, which is a coronavirus. This virus is a kind of a virus that causes infection in nose, sinuses, or upper throat. Most coronavirus aren't dangerous, but in 2020, after December 2019 outbreak in China, the World Health Organization identified a new type of this virus which can be fatal. The organism named the disease it caused as COVID-19. The outbreak moved quickly from China around the world and spread like other coronavirus do. A symptom appear within 2 to 14 days from the exposure, and it is appear like common cold with fever, cough, shortness of breath, and can cause death and as a result of pneumonia and respiratory failure or septic shock. Coronavirus get their name from their crown-like shape. The virus spread like other cold-causing viruses do from the infected person by sneezing and coughing or touching with the infected person. This virus can be controlled by clean hands with swab and water or alcohol, cover nose and mouth when coughing and sneezing, avoid close contact with anyone with cold flu-like symptoms, thoroughly cook meat and eggs, and avoid unprotected contact with live wild or farm animals. Thank you for listening with my best regards. Thank you.